Speaking of Democratic organizations, a quote from Senator Hillary Clinton, a recent quote. "I have never advocated socialized medicine. That has been right-wing attack on me for 15 years." End quote. I have never advocated socialized medicine. Your response.
Here's another Hillary Clinton quote. "Some decisions are so important that people can't make them. Government has to make it for them." And that's one that's quoted in a book about Denny Hastert that Hillary Clinton made back in 1994, 1995. And look, you can call it anything you want. If the government takes over health care, that's socialized medicine. If the government runs it, it's socialized medicine. And the more you move people away from private coverage toward government coverage, the more we're getting towards socialized medicine, which is the kind of medicine they have in countries that where people don't want to use their medical system, are paying bribes basically to get out of it.
How does Rudy Care differ from Hillary Care?
It's a free market solution. It's a solution in which we change the paradigm from government big employer coverage to individual coverage. We give people more choice. If you want to look at something that runs through my philosophy, I think that we do better, America grows, when in each generation we increase the amount of control we give people over their own lives. And it's your health insurance. You should make the choice about it. We should give you a tax deduction, a tax incentive to go buy your own. It'll fit modern America. It'll fit the era in which a young person is going to work for 4 to 10 different employers in the next 20 to 25 years, not the one big employer. It'll give you an opportunity to develop equity along the way because you can have a health savings account. And to the extent that you don't spend it, it'll be growing. It'll be tax-free money growing. So it has a totally different solution.
Even with the tax deduction, what do you do with the low income people?
Okay.
That's the question that always pops up.
Remember, I wish I had a little chart here. The poorest people are not the people that are not covered. The poorest people have Medicaid.
Right.
It's that category of people who have money but not enough to afford it. So you create a private market to drive the price down. What I say to people is, how do poor people eventually, how are they able to afford cell phones? How are they able to afford radios? How are they able to afford televisions? Because the price has been driven down by all the people who buy those things to a price that they can afford. That is not happening in our healthcare insurance market. Our healthcare insurance market is more of a government employer-dominated market without these forces that drive prices down. That's the way, and this is the thing that the liberals do not want to accept. The model that Hillary Clinton has and Barack Obama and John Edwards is inevitably going to increase cost. It always does. Cover more people in one plan, cover more people by government, prices go up, quality goes down. Create a big market, prices go down and quality goes up.